Today, I'm going to be talking about the COVID-19 Core, which stands for Collaborative Outcomes Research Enterprise. So this is a collaborative effort that started in March, and this is really on behalf of a lot of people, including the Center for Outcomes and Effectiveness Research and Education and the CCTS. So this initiative started in March, shortly after we all went remote, with the purpose to engage a collaborative working group to coordinate, collate, and facilitate rigorous and expeditious completion of COVID-19 health services outcomes and population health studies. And we, initially came up with a list of what we thought we were going to do. And so that was to, collate and be a clearinghouse of COVID-19 databases, determination and development of specific COVID-19 cohorts and phenotypes, coming up with a concept proposal form so that we could help to, build teams and make sure that people weren't kind of stepping on each other's toes to the extent possible. Be like database and informatics liaisons to help with directing people to biostats epi research design so that we could promote the most rigorous analyses possible, and then to explore multi-site collaborative opportunities across CCTS. Some of these things we've done more than others. It became apparent early that the health systems and outside of UAB that ADPH and JCDH had just way too much to do to really partner with us at this time in terms of research instead of the public health practice. We have really focused a lot on trying to make the UAB Health System's administrative data as usable as possible for as many people as possible. And I'll talk a little bit more about that. And in terms of the CCTS partner network, a lot of what we have done has been sort of related to this National COVID Cohort Collaborative, or N3C, which is NCAT's sponsored collaborative research network. Honestly, we've been sort of helping people think about what's in that data, what might be usable, but it's a complex set of data and a complex analysis environment, but basically it's a repository, fairly open source, kind of a little nebulous in terms of what's there and what you can do with it. But it's data from a lot of the Center for CCTS. So I'm trying to remember all the different acronyms, but those clinical and translational science awards. And then the other thing that has been sort of simmering in the background and hopefully will actually really get started is long-term prospective follow-up post-COVID in collaboration with the COVID-19 Enterprise Protocol, which is the CCTS sponsored human subjects protocol that's meant to coordinate research with UAB patients and make that as efficient as possible. So this is something that I am leading along with Michael Magavero from ID and Becky Remy, who's also now faculty member in ID as our program director. We have scientific and programmatic working group leads and an advisory committee. And there's about 100 investigators from across UAB who've been involved to one extent or another. This is really sort of fluid and evolving over time. When we started this out, we had some programmatic working groups. The health systems data working group is currently the most active and is the one that is really moving things ahead and has been the most productive. We had a questionnaire and patient reported outcomes data working group. And that really developed the that group really developed the questionnaires that we're hoping to implement for our long-term follow-up. And so that's, that piece is pretty much done. So that group is on hold. As I mentioned, we figured out early on that our community partners did not have, this was not their priority, rightly so. So we have disbanded that one. And then we have a research coordinating committee that is more or less active. We have a number of scientific working groups, and so these were put together really based on thinking about how the different investigators who were involved in this effort, what might be the themes. Some of these, again, some of the working groups are going full steam ahead, and some of them are a little bit are quiet or have disbanded. So for example, we had this comorbidities working group, and it turned out that was just too generic. On the other hand, the neurocognitive group has really gelled, and while they're, and really is meeting regularly and putting together grant applications and such. Really the biggest piece of what we have been doing is facilitating access to the UAB Health Systems data. So as you probably all know, data are available through I2B2. And so you can go in, you can do self-service. And for a lot of people in the School of Public Health, that's great. You can go in, you can, manage it and make it into something analyzable. And these are, raw form diagnosis codes, procedure codes, lab values, medications across multiple data tables, many, many data tables. What this I2B2 data doesn't have is a variable like diabetes or like bilateral pulmonary infiltrates, or, a lot of the sort of things that we'd want to know about people with COVID. We don't even have a sort of flag for, was this person in the ICU? So all that stuff, all those sorts of variables need to be created. And so what we wound up doing was setting up COVID Core as a registry so that we could provide transformed analysis-ready data sets to investigators that are specific to the study question. And what we've done is we've come up with a sort of pathway that where people can work with us. So we've got the gateway to this is a concept proposal. That concept proposal is put together, it's got, what's your scientific question, who's your study population, what kind of key variables are needed. And then there's a meeting, our scientific gateway meeting, that includes the enterprise data warehouse team. It includes, so those are the people who work on the I2B2 side through the CCTS, and Matt Wyatt and his team. Outcomes research, biostats, epi research design, and then clinical informatics. And so from there, we work with the investigator to really tighten up their question. We think about, is this feasible? Do we even have the data that they need to do this question? Some people are ready to go and we can send them to I2B2 self-service and they're off and running. Some people who need to link this to biospecimens, we send to the CCTS Enterprise Protocol Biospecimens Committee, because they have, they're tasked with making sure that those precious biospecimens are used in the most efficient way possible. Some people get routed to a more intensive bird clinic. So if the study design is not well defined or is not crisp, we'll often have a more intensive thinking about the epidemiology and biostatistics side of things. From there, we help people get either non-human subjects or an exempt IRB protocol linked to this registry. And then once that IRB is in place, there's a what's called the data gateway meeting. And so that's a meeting with the data warehouse group and the clinical informatics group. And that's where you really sort of work through the nuts and bolts of, how do you define these different variables? What exactly are your variables going to be? The data warehouse team extracts a data set, and then the clinical informatics group transforms that to make a study-specific data set. And so this has been sort of a work in progress. We've had roughly 25 investigators go at least start this process. And the transformation step is really a huge lift. So I think, Sudeep is on the call and he's worked with this I2B2 data. A number of other people have worked with various administrative and claims data sets, and you're aware that this is just a huge amount of work. We are working to make these, you know, these sort of composite variables generalizable across studies. So, you know, we're building up our library, and that's helping substantially. And then we're also working to port those back into I2B2 so that hopefully the I2B2 self-service will be a little more user-friendly in the future. We have, so the next steps, prospective follow-up of UAB patients with COVID-19, the IRB amendments in process, and we're going to hope to pilot this in January. And then we're expanding the UAB Health System data extraction and transformation process to other conditions, and potentially developing a service center housed within CORE to do this. And my last slide is the website link.